Hi all, I am Swatilekha. After a long day, again I am here to make a new video. Actually, last few weeks I was too much busy in my college work. All the things were going on, so I didn't get any time to make videos. So today, just after coming from college, I'm sitting to make a new video because I know it's like a long gap between this last video and this when this video I will upload. So today I thought it's better to clear the concept of nursing, how expectation versus reality, because already another one new year has come, 2019 2020, new academic session, new admission will be there in GNM course, new admission will be there for B.Sc nursing course and all those. So I thought it's better to clear the expectation versus reality in nursing profession. So the first point what I feel is really very important is salary. See, if anybody, so many people are commenting in my English YouTube channel, Bengali YouTube channel, that in nursing, how to come nursing, how to do GNM nursing, how to do B.Sc nursing, M.Sc nursing and all those, along with salary, work scope. So let me clear in salary part. If you are expecting like after finishing of the course, GNM course, M.Sc course, suddenly you will get a lot of money, exactly that is not possible. It is not like the profession how any another persons, any engineer, any doctor, they are getting just after finishing of their MBBS, as much as money they are earning, that much money suddenly nurses cannot get. It is depending on the situation, type of workplace where you are getting your job, it is private or it's government. But exactly, if your expectation suddenly you will get like 40,000 50,000, it is your expectation, it's not exactly possible. Previously also few videos I told that in GNM nursing, especially in GNM course, after finishing of the GNM course, maybe the salary will start with 10,000 11,000. Again I'm saying it is depending on the place, it is depending on the place and situation. Some place maybe starting they will give 14 to 15, or some place they maybe, especially these South India places, maybe they will give like 7,000 8,000. And again clinical and teaching, both side money will vary. Clinical side little bit money is more, teaching side little bit money is less. So this is the reality. If you are expecting a lot more money suddenly after finishing of your nursing, whether it is GNM, whether it is B.Sc, it is not possible. That is actual reality. But yes, according to your experience, according to your knowledge and qualification, the money will increase. How much money you are getting in GNM, in B.Sc, that money will increase if you become B.Sc or M.Sc. And obviously from private, if you are going to government, the money will be more. Suppose I'm giving an example, in any central government job, depending on the scale, depending on the grade, the money will be like 45,000 50,000, whereas in the private maybe the money is starting only with 11,000 12,000. And salary will be more when you will go to abroad, you will go to Saudi, you will go to UK and all those places, you may get a lot of money you cannot imagine. So easily you can understand that salary part is totally variable. It's depending on the situation, place, it is government or it is private or whatever situation. And not only that, in India you can get a lot more money, but you have to go that type of place. Maybe some place it's in a rural place, it's very far place from main city, they are not getting any candidates. That time you are also in search of job, they are also giving a lot more money, you can negotiate to get more. So that situation you can get a lot more money when you will stay in India. That situation also can happen. I also got one or two offer like that, but depending on my situation and my personal life, I was not able to take that type of offers. But that types of offers also you were able to get. It is possible. Next one, work or duty schedule. Now if your expectation is your work or duty schedule will be like other people, like 9 to 5 or 10 to 5, like school teachers 10 to 5, like that, it exactly is not possible. If your expectation is like this is not the reality. You already know the people are going for clinical duties, morning duty, evening duty, night duty. Some duty timing is there, morning time 8 to 2, evening 2 to 8, then 9 8 to 8, like that. All or if somebody is working in nursing college, nursing school, then depending on their designation, 8 to 4 duty, 9 to 5 duty, that type of duty is there. So due to schedule, it will vary. If you'll work exactly in field, if you're working in some project, if you're working in some OPD situation, or whatever area you will work, so depending on that your duty schedule will be changed. But yes, I can say if you're working in nursing school or nursing college, that one is more or less like similar to the expectation, like 9 to 5 job, 8 to 4 job. That is a kind of fixed thing, but obviously depending on the situation and work, it can be more. Like last 2 or 3 weeks I am coming, I used to come every day from college at the time of 6:30, 7, like that. So much work is there, so these situations are also happening. So third one is uniform or dress. Now uniform or dress, somebody is thinking that in general workplaces, general offices, they are going with very beautiful dress, very elegant dress and all those stuff. Nursing, exactly, obviously it's not possible. If somebody is working in clinical, uniform will be there. According to the uniform, that has where they have to go, they have to prepare themselves. And obviously if somebody is working in nursing school and nursing college, again the same thing, depending on the location and place, which college, which nursing school it is, depending on that dresses will be there. Some places are having saris, no more dress codes are there, but some places are maybe having saris along with some colors and all those stuff. And obviously for clinical situation, my apron is must, so all the stuff is going on. So naturally in expectation, if some of you are thinking that this type of dress you will wear with these lots of ornaments, jewelry and all those stuff, this exactly is not possible. But obviously depending on the situation, hospital, some hospitals are allowing, some places are allowing little bit jewelry, little bit makeup and all those stuff, and still some place they are not allowing. So if expectation will be like this, reality is like this, already I told. Then next one you will see personal life. Yes, personal life, if somebody is thinking that personal life will like normal people, obviously it will not be like normal people, because we can see from this duty schedule, because as the duty schedule is like that, so obviously normal pattern of life, normal life, what exactly we are thinking, that morning time we will go for work, evening time we will go for home, we will sit with our relatives, we'll sit with our family members, we will take food, we will go sleep, again next day work. No, not exactly that will happen. Obviously changes will be there depending on your duty schedule. So personal life may be hampered, or depending on your family members, depending on your partner, depending of their adjusting mentality, it can help you, it can help you to adjust and cope with your professional life. So obviously personal life may be hampered, may not be hampered, depending on the situation. One more example I want to give. If somebody is working in clinical setup, somebody is working as staff nurse, somebody is working as a sister in charge, ward in charge, some responsible duty they are having. So that time what exactly happened, maybe home they went, maybe home they are for their own work, and they're spending their own time. At that time suddenly happened in ward, something happened in hospital, and they are responsible to check those particular few things. So that time call may come, they have to go, rush may be there, a lot of tension may be there. So especially for the clinical areas, this type of thing is there. For again I am saying, for teaching, this is little bit like normal life, what we exactly we are expecting to understand the normal life of the people. So this is the expectation. If you are having like this, reality will be like this. Next one, you will see type of work. Now what is this type of work? Type of work, obviously it will depend on the situation. If it is clinical and somebody is thinking, expectation is like only injection will be there, and we have to take this injection, we have to go and give the injection. Obviously that is not the reality. If somebody is working as staff nurse, as clinical nurse, they are working in clinical, they will have a lot of work. So obviously what will be the expectation, reality will be different, totally different. I can give my example. After my M.Sc Nursing, I worked as nursing educator in medical super specialty hospital in Kolkata. So obviously my expectation that time was that nursing educator, so that means I will go to ward, I will stay with staff nurses, I will teach them, I will tell them new things and all those stuff and equipments and how to do all those works. But basically that was my expectation. But reality, what exactly happened, in ward, so many patients in a particular ward where I was posted, there maybe like 35 to 40 patients were there, and only 5 nurses are there. So easily you can imagine 30 patients, at least 30 patients or 5 nurses. So they are getting like 5 or 6 allocations of patients, so they are running like anything. And instead of what my expectation was, that teaching to the staff nurses, I was also running with them, I was doing the admission, I was doing the discharge, I am doing this IV cannulation, I was giving this injection, sample collection, catheterization. So lot of the procedures were basically staff nurses has to do, and I will teach them. That is my expectation. That totally destroyed, and it didn't happen. But that was the reality of my work life then as a nursing educator. So easily you can imagine what exactly can happen in type of work, in expectation versus reality. So obviously it may change. And in case of teaching, I can say that whatever is that expectation, more or less same will be there, because teaching already teaching to the students, and especially if good places will be there along with the teaching of the students, you can get chance to go to clinicals, be with the students, you also will learn new things and all those stuff. So for teaching it's more or less okay, expectation versus reality more or less okay. But for clinical it may be totally different. What you will expect, it may be more, suddenly the workload may be more which you didn't imagine. Or sometimes it may happen that you did you get your posting as OPD nurse, you get your posting as OT nurse, or some places where the work type is totally different, workload is totally different. For which one you are thinking it is not a workload, I am very relaxed, I am very free. So obviously depending of the posting, depending of the work, there will be this type of work, it also will change. So again, expectation versus reality, it's not matching actually. And leave, yes, if somebody is thinking, I'm not talking about the private situations, private places, I'm talking about the government one. This one will be applicable there. Okay, suppose like all the other government employees, if nurses who are also government employees, if they will think like them, we will also get leave, this is their expectation. Obviously it is not possible. Again, so many notice will come, circular will come, you are healthcare worker, you cannot get that much leave. So it's totally different. So like the government employees, how much leave they will get, obviously as nurses, obviously healthcare workers, they will not get that much leave. So in reality it's totally different from the expectations. So it is also not like this thing. One more thing I forget to write it here, but I want to mention, and I want to finish with that point: job scope. Expectation versus reality. Yes, here expectation versus reality matches as per my view, as per my expectation. It may be very little bit depending on the situation and time. Again I am saying job scope, as per my opinion, it's matching. Why? Because a lot of scope is there for nursing nowadays, in hospital, in nursing school, nursing colleges, abroad. Everybody will call you for job and all those stuff. If you will put your CV in Naukri.com, timesjob.com, if you will put your CV in Indeed.com, those websites are there. If you put your CV there and you keep updating that one, so you will see almost like within few days you will get call for every type of job. You can get call for clinical staff nurse job, you can get call for a teaching type of job, or any another company type of job. So and for outside abroad call also you can get UK, Canada, Saudi and all those places. So it's like job scope is too much. So what is your expectation after finishing off your course? That I will get a lot of job and I don't have to sit at home. Obviously this is your expectation, and reality, obviously you will get job. You don't have to sit, you don't have to worry about your job, you will get a lot of job. So as per my experience and my opinion, this one is matching job scope, expectation versus reality. This one is matching. So almost I discussed about 7 points. If you are viewers, if you are thinking that if some more points should be added where we can talk about, where we can see about the expectation versus reality in nursing and it's matching, or if it is not matching, please comment and let me know. I will be happy. And if you like this video, don't forget to share, like and comment, and obviously subscribe. And thank you for watching.